Hickey, or Dr. H, as many of my students refer to me. I want to welcome you to another episode of the International Service Learning Experiential Medical Education podcast. During each episode, I will be interviewing healthcare-focused students and faculty from high school to university that have had an opportunity to participate in an international service learning trip. Additionally, I will be discussing the benefits and challenges to international service with healthcare professionals that have served abroad, as well as industry leaders in healthcare, education, study abroad, spirituality, and those living in the countries being served. So I'm real excited today to have guests with us, and our guest today is Lauren, and this is someone I've known for quite a while, actually. Lauren's a student, or was a student, actually, at the University of South Carolina. Recently graduated. I'll let her tell you a little bit more about herself. But we've had an opportunity to meet actually quite a few times on campus. One thing I do sort of in my part-time as a retired university professor, I like to go up to the university and meet and greet and I guess mentor students and sit down and chat with them and look at their resumes and find out where they're at and see if there's anything I can do with all of my contacts. So Lauren's been one of those that I've been able to help along the way, and I feel very privileged to have her with us today. And she's got a lot to tell us. Not only did she recently do a service learning trip, and that was one of the major reasons we were having on here, but she's also going to be taking over social media for ISL, so we're excited for that. Maddie, who had been doing our social media, is off on travels, and Maddie's heading to med school, and I guess Lauren's heading to med school herself, and she's going to be a little bit further behind. But all that said, happy to have Lauren with us. And Lauren, before I go on, if you don't mind, just tell us a little about your own pre-med journey.
Yeah, of course. Hi, everyone. This is Lauren here. I didn't always knew I wanted to be a doctor. It was on my radar, but I actually began college as a biomedical engineering major because I thought I wanted to do prosthetics for amputees. And I knew within my first semester it didn't feel quite right. I was lingering for something more. So I switched to a biology major and I joined Phi Delta Epsilon, which is our pre-medical fraternity at school. And that was during my spring of freshman year. And ever since then, it kind of took off. I knew this was my calling. I got involved in research with autism at the Early Social Development Lab. I began volunteering at the Free Medical Clinic in downtown Columbia, helping patients who do not have insurance or can't afford it. And I began shadowing some surgeons at Prisma. And I just knew that this was what I wanted to do. And I graduated in December of 2024. And I will hopefully be matriculating into med school in the year 2027.
Oh, that's great. I'm glad you shared your journey. I know everyone's journey is a little bit different, but it's great to hear that you were involved in research and the other things that you did, because that's great examples of what students may want to do and didn't even think about it. Now, tell us about your graduation present to yourself. I guess you did something in February.
I did, yes. Since I graduated early, I was able to go to a service learning trip to Belize for a beautiful 10 days. I've never been to the country before, so I was very excited. And this was something I always wanted to do during my undergrad years, just could never find the time or money. But now that I'm graduated and I'm working full time as a medical assistant, I was able to pay for this trip with the help of the ISL scholarship as well. And it was awesome. I'm so blessed I was able to go on it.
Lauren, everyone's motivated by different things for the trip. I see a lot of students that are interested in going to med school that feel it might help prepare them. What was it that motivated you to sign up for this service learning trip?
This is something I've always wanted to do. I was drawn to the opportunity to combine service with hands-on learning in a, global setting. The chance to work with communities in Belize, especially in this healthcare environment, really stood out to me. I'm passionate about helping others, especially those who don't have access to healthcare. And without people like us going to them, they may never actually receive this care. So it was a meaningful way to step outside my comfort zone and just gain a better understanding of global health disparities in comparison to the US.
Now, Lauren, had you been on a service learning trip prior to this experience, or had you done anything faith-based in the United States?
No, this was my first time ever doing a service learning trip,
What were your
and
expectations? I
it's
know you
awesome.
probably have, I know you probably have spoken to a few people that have been on the trip since you've been involved in FIDE and other organizations, but what preconceived notions did you have about either the country or the healthcare system?
Yeah, I went into the experience with a general understanding that resources might be more limited compared to what we have here. But I honestly tried not to make too many assumptions about Belize or its healthcare system. I wanted to stay open-minded and learn directly from the people that work there. So to prepare, I did some background research on Belize and the healthcare structure. And on day one of orientation, they also taught us a lot. But I just wanted to keep an open mind truly about the whole thing. And we did pack some medical supplies as well, just to make sure we had gloves and everyone had a stethoscope. But beyond that, I just try to be flexible and respectful and ready to adapt to whatever experience it was going to be.
I'm glad you shared adaptability. That's something that we try to help the students to be flexible and roll with whatever is coming because you really don't know how to prepare or how to prepare as best possible. Now, what did you hope to learn or accomplish both professionally and personally by going on this trip? Because as you said earlier, you didn't have the money during your undergrad and time you didn't have it either. So, what was it you were looking forward to on this trip?
Professionally, I wanted to gain a better understanding of how medicine is practiced in other cultures and settings who have more limited resources than us. I wanted to see firsthand how their healthcare systems operated and compare that to the US and learn from those differences. It also helped me reflect on how fortunate we are and how fortunate I will be to be a practicing physician in the US, where we have access to all these resources and opportunities to provide high quality care and ultimately save lives. Personally, I wanted to experience healthcare in a rural country, so I'm able to be more empathetic and well rounded as a doctor. It's important to me to understand where patients are coming from and learn to meet them where they are, both medically and personally. And I've done that, in my volunteering at the free medical clinic, but it was cool to do it actually in their country.
I know it may be a little premature right now, but do you have any idea of what you want to do as a physician?
I am so back and forth. I always thought it was going to be dermatology. And then, and actually, on the trip, I saw my first cesarean section, and now OB-GYN is on the radar for me as well. Seeing life being brought into the world is the coolest thing I've seen so far. So hopefully, I'll get a better scope once I start medical school and do more rotations.
I've enjoyed working with so many students over the years that kind of sort of think they know what they want to do, then they go through the rotations or they go on one of these trips and they change quite often. And there's nothing wrong with that. And that's but it is pretty cool to be able to see a life coming into this world. I totally agree. That's an amazing experience. I've had students with me before on previous trips that have just literally started crying when they saw delivery. What a blessing.
Yes.
What a wonderful opportunity you had there. So tell us what a typical day was like on your trip.
A typical day on the trip started with waking up around 7 or 8 a.m. We'd all have breakfast together as a group. After that, for my particular trip, we would split into teams. So some of us went to the clinic while others were in hospital shadowing. During clinic days, we were either going out into the community and inviting patients to the clinic, or we would actually be setting up clinic and seeing patients directly and providing care. For days that we were shadowing the hospital, we were rotating through different departments. We would round with physicians and observing surgeries. We would all come back together for lunch, and then we would continue activities in the afternoon. At the end of the day, we went back to the hotel. We would have dinner as a group, reflect on our day, recap on experiences, and then we had spent time together playing games. And we were talking to the med students the whole trip. Since my trip, I got to go with fourth year med students, so we picked their brains the whole time about what they do. So yeah, lots of late night talks before going to bed.
Now, you mentioned the med students. Your trip was unique, and it was actually the inaugural fourth year med student gap year student trip. What was it like being mentored by fourth year med students?
Being mentored by the fourth year med students was so valuable. They really were a great addition to the group, and they helped us understand how to approach cases and what to look for during physical exams and how to, do a better workup with the patients. I also appreciated how approachable they were. They created a really supportive learning environment for us and, made us comfortable asking questions and knowing that it's okay to make mistakes. It was especially inspiring to see them because that's where I want to be in 4 years. So it gave me a better picture of what my path in medicine could look like.
Yeah, it's great. I'm really, really glad that we were able to pull that trip together and glad that you were able to benefit from that. What was the most surprising thing that you encountered on the trip and the most challenging thing?
The most surprising thing I encountered was how limited the number of specialty doctors there are in Belize. And also in Belize, there's only four major hospitals, one for each region. And specialty doctors would transport between those regions because there's only a couple. I was talking to a orthopedic surgeon, and he said he was only one of two that was go to the three
Hmm.
regions, and then the eastern region was the biggest hospital, so they had more there. But out in rural Belize, he was said one of two. So that was crazy to think about in comparison to the United States, where we probably have two surgeons, in one hospital in one town, and they have that for the whole country.
Hmm.
The most challenging part for me, I would say, is learning how to navigate the resource limitations we had when dealing with patients. It was emotionally hard at times to see what care options we had and what we could get for them because some just wasn't realistic in the setting that they're in, that we would treat with surgery and physical care, but they don't have that there. But at the same time, it did push me to be more flexible and focus on meeting patients where they are to give them more of a personalized experience.
Now, you mentioned the orthopedic surgeon. What was it like working with the local healthcare professionals? Were you able to learn from them? Were they very forthcoming with information? Did they teach you?
Yeah, it was really cool to work with them. They were so knowledgeable, resourceful, efficient, and it was interesting to observe how they adapted care based on the resources they have. One thing that stood out to me also was a lot of the workers, like not even just physicians, but they are bilingual. So even though Spanish isn't the primary language in Belize, there are a lot of patients who do speak only Spanish. So it was cool to watch them translate and, be able to talk to patients in Spanish and then translate for us in English what they were doing. So they were awesome to work with. I really enjoyed talking to them and seeing how their med journey is different than how we do it in the States.
Was there anyone, patient or community member who made a lasting impression on yourself?
Yes, there was a sweet older woman when we were going into the communities to invite patients to clinic. And she had so many dogs outside, and she'd previously broken her hip, which required surgery, and she got that fixed. However, she still wasn't able to walk well, and where her house was very rough terrain, and she had 10, 15 stairs going up to her front porch. So I thought, this would make her life pretty hard, but she was the happiest person I've
Mhm.
ever met, and she had such a positive attitude, and she welcomed us warmly and made us laugh and just shared stories and let us, play with her dogs. So it was just really wholesome to see how someone that has a, debilitating condition is still the kindest person.
Were there any cultural challenges on the trip? I know you said that Spanish wasn't a predominant language, but there was a variety of language challenges. But what stood out to you culturally that was maybe a little stressful?
Yeah, culturally wise, I think it was mostly just how they live there is very different than here. This is rural and it's hard to imagine what you would think it is, but actually being there, there's just so many people everywhere on the streets, walking in the stores. Also, a lot of the markets and even the hospital is just open windows. They,
Mhm.
they don't have centralized AC and heat, so everything is open, no windows, no doors. So that was probably the weirdest thing to me, was just walking into a hospital and like seeing the outside from your room. But at the same time, maybe it's good for our mental health that we see the trees and the sun. So, but yeah, it was still cool to see. And I just reminded myself where I was and made the most of it.
Did you, in the limited time that you were there, Lauren, did you feel that you made a difference?
Oh, absolutely. We all made a difference while we were there, whether it was helping with patients, assisting in clinic, or just spending time with the community members. I felt like we were able to contribute meaningfully to their care and experience. At the same time, I recognized that this impact wasn't just one directional. The experience taught me just as much, if not more, that I was able to give. Reinforced for me that making a difference in healthcare isn't always about these big interventions or procedures or long drawn out plans. It's really just about being present and compassion and helping support a system that is doing its best with the resources it has.
Yeah, I'm glad you shared that because I know a lot of my students wonder if they really made a difference when they come back, and I try to reinforce just even if they spend some time, as you shared with that older lady, even if you spend a little bit of time, you made their day, and
Mhm.
like a ray of sunshine, so to speak. Put a smile on someone's face, play with a kid for a little while. In fact, kids, were there a lot of children at the clinics or in the hospital where you were?
Yes, there's definitely a lot of kids in the communities. They were quite small. The schooling is K through 12. They had all the students there because there's only about probably 20 in that community. But hospital was always busy, and the outpatient clinic was always flooded with patients and lots of children.
Ask you, what were your emotions like when you did come back home? Because this was probably a life-changing experience for you to see the healthcare system and to see the communities and how the people lived. Was it hard readjusting, or were there any challenges?
Yeah, coming home, I was a mix of emotions. I was grateful. I did some reflection, a little bit of sadness too that my trip had come to an end. I was grateful for everything I had learned and the people I got to meet. I also found myself thinking a lot about the patients and communities we worked with and what their daily realities were. So readjusting back home was a bit of a shift at first. But I've also noticed that I've been more reflective in everyday life and more appreciative of the healthcare resources we have here. So overall, it's been a really grounding experience that I continue to think about daily, even after returning.
Well, with that reflection, how has it changed your, excuse me, your perspective on our healthcare system? Is there anything that you'll try to incorporate into your future healthcare practices because of the experience that you've had in Belize?
Yeah, seeing healthcare in a setting with much fewer doctors, fewer hospitals, and greater barriers to transportation showed me like how much systems and infrastructure impact our patient outcomes just beyond medical knowledge. So it made me more mindful of the importance of, again, meeting patients where they are, both culturally and practically, and trying to understand broader factors that may affect their ability to receive care. So overall, I've come back with a deeper appreciation for the resources we have in the US and a stronger desire to be a physician who is adaptable and empathetic and aware of these healthcare disparities when I'm talking with my patients.
Now, you had this wonderful opportunity to be involved in global health. Were you able to come up with any ideas on what would be the best way to impact global health in the future, either for yourself or others?
Yeah, I believe the most impactful way to contribute to global health is through long-term partnership and capacity building within communities rather than just short-term, like one-time interventions.
You have a lot of ISL teams that come back to the same communities each year, and by doing so, they see the growth and the change in those communities. And I think what you're sharing is that's very impactful. Continuing to see the growth, connecting with the community, as you said, is a way of maintaining that relationship, and I like that. What about students that are thinking about a similar trip? I know having dealt with students over the last 15, 20 years, a lot of times I see students that are really eager to go. Some are kind of on the fence. Some have moms and dads that maybe don't want them to go on the trip. What would you say? How would you prepare them for the experience?
Well, if anyone's hesitant or is not thinking about this, I'm going to try to change their mind because everyone needs to experience this trip at least once in their life. So I would tell the students to absolutely say yes and go on the trip. Keep an open mind and be realistic with your expectations. It's important to prepare, the basics of what you'll be doing in clinic and also taking time to research the culture and the healthcare system, but really just focus on listening and observing to the professionals once you arrive and paying attention at orientation. Again, packing supplies was good, having a stethoscope, gloves, masks, be ready to work as a team, and be humble throughout the experience makes a big difference. Most importantly, I tell them to embrace it all. It challenges you, but it's incredibly rewarding and eye-opening.
Should students worry about their food choices? Because I understand that you get to go out and eat in the evenings. Are there enough food choices, or are there foods that you probably have never heard of, but you tried and liked it?
Yeah, our ISL leader took us out to dinner, I think 2 or 3 times, and he took us to restaurants with plenty of options. Really beautiful, actually. We ate at the tallest peak in Belize, overlooking the water on a cliff. That was really beautiful. And food over there is a lot cheaper than here. So I was eating very well. I was eating steak and potatoes and lobster and a whole bunch of stuff. So there's plenty of options.
Lauren, tell us, switching gears a little bit, tell us now about your new role with ISL.
Yes, I am very excited to be taking over social media coordinator for international service learning. With this role, I will run our official Instagram account, hopefully posting real-time content that highlights our service work and all the communities we work with. I will also be coordinating with each service trip team to organize Instagram takeover days where they will share their experiences directly on the ground in the country. So it's been a great way to keep our audience engaged.
And Lauren, you and I have just discussed a little bit offline about service itself, and how would you like the students to better share their service experiences? Because we know we see a lot of their sharing of recreational activities, which we love. Because I mean, how cool is it to swim with the sharks and to go zip lining and all that kind of stuff? We look forward to seeing those. But how better do you believe it would be for students to share their service experiences?
I think to highlight the service while they're either in clinic or going into the community, just showing us what they're doing while they're over there, because it's hard for us to grasp like what you would, I think, ideally what you think of a service learning trip, but being over there is just completely different. And like I said, it's, even the structures alone, like when you think of a hospital, you think of a hospital in the US, but a hospital over there is, just four walls, and, that's with our hospital. So just really capturing the environment around you and the people you meet, and, highlighting the experiences that you have from your point of view, because everyone's perspective on the trip is different. So trying to get, unique experience from each and every person.
Well, I agree with you. Having been in that hospital that you're mentioning, it's hard to describe. I mean, with
Hmm.
no windows and all open, and I mean, we can say it because we've both been there, but I can't envision it unless we'd seen pictures or videos of it. And yeah, you're right. I think just the everyday routines and the clinics, the homes, the roads, everything about daily life, I think would really help to show not only the service piece but the cultural piece also, which is
Hmm.
so powerful. So when does that start? Your role with ISL?
I think I'm officially starting
Oh
today.
wow.
So from this point forward, be on the lookout. I will be making an introduction post shortly, and every post thereafter is going to be created by Lauren
Well, good.
or Dr. Hickey.
Well, good. Yeah, and I'm glad you're going to be part of the team, and so exciting for students to go on these trips. And for those that are again on the fence, as Lauren shared, you'll get out of your comfort zone. I mean, I've done this, 15, 20 years now. Just came back from the National Student Nursing Association convention in Houston. Was so excited to meet so many nursing students that have already been on these trips before or are looking forward to them. And Lauren can share, as I will share, it is life-changing. It is very humbling to be able to go on these trips. And, it may not be affordable for everybody. And as I share with students, when we get back from the trips, we could have that same experience in our own backyard because we have that same cohort of patients probably within miles of where we're living. But for those that can afford and can step out of their comfort zone and do an international trip, it is well worth it. And it is unforgettable. Lauren, any last words you'd like to share before we sign off?
I would just say do it, guys. If you're on the fence or if it's not something you haven't thought about, definitely do it. It's something you won't forget. And I am honestly looking forward to hopefully going on another one very soon.
Well, yeah, and actually because of Lauren's trip, 2 students on her trip now are going to be leading their own trips. Lauren was on a 4th-year med student gap year trip. Now we've got 2 students that were with her, both gap year students that are leading their own gap year trips. Bryce is going to be leading a trip to Tanzania. Date and time and price and all that yet to be determined. And Ava is going to be leading a trip back to Belize, actually. Again, date and time and price yet to be determined. I think we should know all that within the next week, and it'll all be posted on our website really soon. So one last thing, you're in your gap year and you're working. Can you share where you're working at now and what your previous role was and what your new role is?
Yes. So I moved to Charleston last October and I began as a office assistant for a dermatology practice in Mount Pleasant. And I was there for 6 months, but I wanted to get more hands-on clinical experience. So I'm transitioned into a medical assistant role at Charleston Allergy and Asthma. And this has been a really cool experience. This was a new specialty that I haven't really gotten exposure to. It's not talked about much, allergies and immunology, but we do some really cool allergy testing and pulmonary lung function. So it's been really cool to see that. And we work with, from babies all the way up to geriatrics. So I'm really excited for it.
As a gap year student, do you recommend your peers to do as you're doing, get involved in a healthcare role?
Definitely, especially if, you didn't have that much time in undergrad or you felt too rushed to, get a job. It's nice to be post-grad and, being able to make my own money and also doing something that I enjoy every day, getting more clinical experience. And the doctors know that I'm, applying to medical school, so they're very knowledgeable and they let me go into the rooms with them and I, ask types of questions. So it's been a really good experience for any pre-med.
And I can share with those listening that Lauren was quite excited last week when she received her MCAT results. So got that done, got that over. Now she can relax, right?
Yes. And don't worry, guys, it took it more than once. So don't be panicking over it.
Well, my experience has been with those that have written the MCATs, those that have not done so well or as well as they wanted. When they reflect back on it, it usually because they're just doing so much at that time. Multitasking
Yes.
is I see a lot of students that are very prideful of being able to multitask, but when you're studying for the MCATs, you've got to put a block of time out there and just block off the world and do it. And if you want to put your best foot forward, so to speak.
Yes, no, it's definitely very time consuming, mentally exhausting to study for the MCAT, but it's just one hurdle you have to get through to, become a doctor. And there's plenty of more, board and state exams that I'll have to take. So knowing I can do this one makes me feel better about the ones to come.
There you go. Well, listen, Lauren, appreciate your time today. Look forward to working with you on the social media and look forward to following your path forward to med school.
Thank you, Dr. Hickey.
You have a good day.
You too.
I want to sincerely thank our guest, Lauren, for her willingness to join us today on the International Service Learning Experiential Medical Education podcast. But most importantly, I want to thank Lauren for the passion she has shared with us. Lauren is a great ambassador for both pre-med and gap year students and service learning. Her future patients and their family members will be very privileged to have her as their healthcare provider. I am hopeful that by sharing details from her service learning trip and now her new role in coordinating social media for ISL, that she will inspire both undergrads and gap year students to step out of their comfort zones and to go for it as far as pursuing a similar opportunity.